So in this video, I'll be going over the main topics that fall under medical malpractice lawsuits, including the definition of medical malpractice lawsuits, the standard of care, the differences between actual medical malpractice and, just unhappiness with your care, and finally, building your case. Let's get into the actual definition of medical malpractice. And it's defined as negligence by a healthcare professional or faculty that results in harm or injury to a patient. And this typically involves the failure to provide the standard of care expected, which can include misdiagnosis, surgical errors, or medication mistakes. And it is rooted in the court of law and addressed as civil wrongs. And it usually compensates, or not usually, we'll get into that later, but it can compensate victims for harm caused by actions or omissions of healthcare providers. And thank you to triallawyersjournal.com for that definition. Okay, so now that we have a definition in our minds of what medical malpractice is, we can get into what the standard of care is, which is a big role in the medical malpractice lawsuits. So here's a quote that I like. In a medical malpractice case, the standard of care is the level of skill and care that reasonably competent healthcare professionals with similar training and in a similar medical community would have provided to a patient in the same situation. It's not about perfection. It is about providing accepted professional care. So that's from Hill and Associates, which I'll use a couple times throughout this video. But yeah, it kind of puts, meaning to the standard of care to, just perfect words that are easily comprehensible to anyone with no prior knowledge of the topic. I thought it'd be a great addition to my video. So different branches of the medical field have different definitions of what standard of care should be for them. So for example, a nurse going to it is going to have a different standard of care set of responsibilities than a brain surgeon would have, or just a typical doctor, like an emergency room doctor. The nurses have a different, standard of care because they're more following orders from the doctors. But it's crucial to understand that none of these rules or responsibilities are set in stone or really written anywhere. So it's simply just a baseline of what duties a healthcare professional should be performing for their patients in a way it's really just common sense, honestly. All right, so now we will be discussing the differences between medical malpractice and being dissatisfied with your care outcome from your treatments, which does happen a lot. So some people confuse being unhappy with the outcome of your surgery or experiencing a symptom that the doctor failed to mention during a consultation as a medical negligence. So they also blame a lack of sympathy, empathy, or just basic report for being negligent. Just making the lines of what medical negligence is just really gray. All right, so now let's get into the logistics of actually building a case. So you should be able to prove 4 key elements, which are duty, breach, causation, and damages. So, I'll put a picture up on the screen over here, but let's just go into each one a little bit. So duty is, you should first show that a doctor-patient relationship existed. And this means, that the healthcare provider had a professional responsibility or duty to care for you. So, and then number 2, breach. You must prove that the provider breached this duty by failing to meet the accepted standard of care. This is the act of negligence. And number 3, so causation. It's not enough to show a doctor made a mistake. You must also prove that the specific breach of care was the direct cause of your injury or made your condition worse. And number 4, finally, is the damages. So you must demonstrate that the injury resulted in actual harm, which can include additional medical bills, lost wages, disability, and pain and suffering. All right, so being able to prove these 4 things is very important to whether or not you will win your case. It's also very important to have a legal team to back you up, especially one that has experience in these topics and in these cases. And you're gonna wanna tell your lawyer every single detail of your encounter with your doctor so they are able to fully grasp and fully understand the situation. If there's a case where severe injury was a result of your negligence, it's pretty important that you document everything that happens in your hospital room. Your vital signs need to be consistently recorded among treatment protocols that were used, as well as test results, and really honestly record as much as you can. Just keep track of everything. And that'll be the best evidence and give you the best shot at winning. Now, the jury does determine whether a case is medical malpractice or just you complaining, honestly. But it's by bringing in other doctors who will testify if they believe the standard of care was breached. And if you have all those things, it's going to be a lot harder for other doctors to say no, because that's just going to make them look bad if they're disagreeing with proof that's right there. All right, so before we conclude, I do want to add that it does get very hard for a patient to win a medical malpractice lawsuits. Most cases never even reach a trial. About 90%, a little bit over, kind of are resolved outside of court, which usually does lead to the patient getting some kind of compensation, which usually money. But when they do go to trial, the healthcare providers win about 80 to 90% of the time, and just basically because the evidence is weak. So that's why you really want to record as much, not necessarily like pull out your phone and record. You can take a picture or whatever. I mean, honestly, do whatever you want, but just make sure you keep track of those, just the statistics and everything. Like I said, your vitals, what they've give you, just every single encounter with that doctor. But, you hopefully you can trust that your doctor is gonna actually take care of you, which the majority will, but this does happen. So, but yeah, even when there is, like good evidence against the doctors, they usually win about 50% of the time, which, I mean, it's a coin toss. But yeah, overall, the plaintiffs, which are the patients, they usually win the trial only about 21 to 30% of the times. This is including, just everything that I just went over, just every situation. But meaning that the medical professionals will win roughly about 70 to 79% of trials. But yeah, and I'll put a little graph up here or somewhere, showing that. But yeah, I just wanted to add that before we conclude. But right there is just a basic rundown, kind of get your foot in the door about medical malpractice lawsuits, what it is, and the definitions of everything. If you found this video helpful, like and subscribe. And this is probably just gonna be my mom that watches and Mr. Nate, so shout out y'all. But yeah, I'll see y'all in the next video, which will most likely never happen. Now, I want to add that every source I used will be below in the description of this video.